started, I'm going to give the intro right now. I've got to get to the emails that are coming in. Some people are having some difficulty signing on. Anyway, welcome everyone to our first webinar for the Northeast Association of Equine Practitioners. We're very enthused to have such a large number of people sign up for this webinar. So thank you to everybody getting here. We are going to be continually working on some online continuing education for everyone. But for tonight, Dr. Sarah Cohen is going to be your moderator for the presentation, and I'll turn it over to Sarah.
Thanks, Dave. And thanks to the entire NEAEP Board of Directors for getting this done and being able to present such an exciting kickoff with awesome speakers like Dr. Cricket Russillo and Stuart Muir. So I'm not going to talk long at all. Basically, this is going to go really fast. We have an hour to hear a lot of really important information. There's going to be questions that are going to come up. This is our first time doing it. So what we're going to do, and we're going to see how it works, is have people roll in their questions using the functions that are available to you. And I'm going to be monitoring them, and I'm going to ask and do my very best to get most of the questions answered at various points during this presentation. They're probably not all going to get answered, but we're here. I will promise to do my best to get questions answered even after the fact, if I can. So neither of these speakers need much introduction. Their reputation precedes them, but we're going to start with Dr. Cricket Russillo, who is a 2001 Tufts graduate. She did a sports medicine internship at Texas A&M, and after that spent 13 years at Fairfield Equine, practicing on elite level sport horses there. And then in 2015, she joined Virginia Equine Imaging. In 2017, was appointed to be the USA Team's dressage veterinarian, and in 2019 received her ICELP certification. So with no further ado, we present to you Caudal heel pain, a veterinarian and farrier's perspective.
Thanks, Sarah, for that introduction, and hi, everybody. It's an honor to be a part of this inaugural group. I am gonna try and pull off my first webinar, so bear with me. Ta-da. So tonight we're going to try and go through relatively quickly, basically how I go through and develop a diagnosis of caudal heel pain and my approach to therapy and management for that situation. I'm going to go through my physical and clinical exams, talk a bit about diagnostic anesthesia, how I get to diagnostic imaging, what choices I use there, some treatment, and then hopefully have enough time to think about the corrective shoeing choices that I use for my patients. Physical exam for me, whether it's a new patient or an existing patient, I try and pay really keen attention to what the hoof capsule is doing, all 4 feet. A lot of time while my clients are giving me their history, I'm wandering around looking at the horse, looking at obviously the whole horse, but the feet in specific, and I might squat down, I might pick up the feet, palpate the feet, just looking for clues that there's been something going on, especially in a new patient. Maybe is there already some corrective shoeing in place on an existing patient? You know, how are the feet holding up? In a chronic case, you might see some signs that there's a problem here: narrowed hoof capsule, contracted heels, asymmetry. In an acute case, palpation findings, swelling and pain, digital pulse, heat, things like that. Looking at balance and angle, of course, and then make sure to record all of that so that I've got a record over time to reflect on. Hoof tester examination is obviously going to be kind of an essential part of every exam, but particularly a horse that you think has caudal heel pain or that you're managing for caudal heel pain. These are the hoof testers I really, really like. It's the Jorvet Riding hoof tester, and that's RYDING. And then here I've got a little video I'm going to try and show you of kind of how I hoof test. it's just going to go on a loop. But, you know, I'm a big systematics kind of person. I just have a habit and I stick to my habit, and that way I don't miss a step every time. And it gives me also a sense of perspective over the long haul with that horse and all the horses, what is kind of a sustainable and appropriate response. So again, I'm going to record these findings, and it sort of tells me something over time, how it goes. Try and get back to my slides. Aha, great. Sorry, so I grade that, you know, mild, mild to moderate, severe, etc. I tend to hoof test with an assistant holding the foot versus me between my legs, but it varies. And I do think it's possible to use an assistant. And sometimes we have a little conversation between ourselves, like, oh, that seemed mild, mild to moderate. What do you think? And etc. I tend not to take advantage of a helper to do the hoof testing for me, because I get so much out of it myself. Clinical exam, you know, just everyone's got their clinical exam, but just a little window into what I'm doing. I watch the horse walk over a smooth and firm surface, the rubber aisle, a driveway, although usually that's smooth. Walk, trot, move on a circle, different surfaces, under saddle, but just looking at flight of the hoof, how it's landing, is it loading symmetrically, and how does that change on the surfaces. A lot of times with foot pain, you can pick up some gait deficits just simply in the turn at the walk. That gives a clue that there's something going on. The manipulative tests here I've listed, I think we're all relatively familiar with using distal limb flexions. I personally don't use the reverse wedge, but I know a lot of really good people, respected colleagues who find it really helpful. It's just not been a tool that I've cultivated using. The dynamic hoof test, though, I do like, especially for caudal heel pain. And for me, it's relatively simple. Have an assistant hold up the foot, and then I'm squeezing across the heels with my hoof testers for a count of 10, and then jog the horse away and look for increased lameness. And a lot of times that really does correlate when there's caudal heel pain. Diagnostic anesthesia. So I got to be honest with you, I think it's really misleading, and I'm relatively simplistic when it comes to nerve blocks. I tend to do distal digital nerve blocks or proximal digital nerve block. I do try and block every horse I look at that I think has a discernible lameness. I really do think it's fundamental to block these horses' lamenesses, but that said, I just don't think the block stays where you want it. I don't think the anatomy groups up the way we'd like to believe it does. And then compounded by the fact I'm working mostly in warm climates, be that Wellington or Virginia, and the block is just moving. So basically what I try and do is 1.5 to 2 mLs of mepivacaine at each site, give it about 5 minutes. I don't get too elaborate with prep, a little alcohol wipe. Do check the block before I move the horse again to have some confirmation that the block has worked. I put the mid-pastern digital nerve block in bold. When I'm starting with a new lameness, I'm pretty methodical, and I'll do the distal digital and then I'll move up the leg. But if it's a case I've been monitoring over time, I will use this mid-pastern digital nerve block, staying well away from the sesamoids and proximal P1 as sort of a, is it foot or not, just to get a sense of how the case is progressing. Intrasynovial blocks are just not something I do a lot of. I personally find the anatomy, again, just so interrelated that I don't think I can conclude anything significant for me from a IA coffin joint block, I guess, unless it's negative. I think that would give me good information, but so for that reason, I tend not to do it. And same goes for the navicular bursa. It's just not a block I'm doing often. So once I've blocked something to the digit, that's when I'm gonna get to diagnostic imaging. And I still really, really recommend radiographs to my clients, a full set of radiographs if I can get it. A lot of times we have a recent full set from a pre-purchase exam, and so maybe we'll just repeat the podiatry series. There's lots of references out there for how to take a good series. I've listed here, I think the most recent 2012 AEP proceedings has a couple good articles about positioning and how to get good x-rays. I'm using a digital system, and for me, the full series is these 4 views. Obviously, clinical guidance is going to shift you here too. If you're worried about a wing fracture, you might take some obliques, but my basic view is those 4. I keep the shoe on for the lateral medial projection and the horizontal DP, and then pull the shoe, prep, and pack the sole for the 2 remaining views. One of the things that Dr. Cohen had asked me to kind of talk about is like the high-low approach. I am lucky that I deal with a lot of clients that can afford advanced imaging options, but if I was really working on a shoestring budget and somebody didn't want to take new x-rays, I would say the one x-ray I would want, no matter what, would be the lateral medial projection. I think that gives me probably the best window into what's going on. Things that I'm looking at, and I'm not a radiologist, so there's probably better ways to look at these things, but for me, how I'm kind of divining what's going on and coming up with my diagnosis, the degree of joint remodeling, coffin or pastern, navicular bone changes, balance obviously coming through here, angle of P3 relative to the solar surface, and sole depth is a big one for me. I think especially in the sport horses I see, they just stop growing foot and we have this sort of reduction of sole depth, and I think that's a lot of the pain that I end up trying to mitigate over time. Should say that I do take the shoes off if I can for those other views. Sorry, I missed that point. And then interval change, looking over time. So again, if I take a new set of rads and I can compare back to the pre-purchase exam and see if there's some further remodeling of the coffin joint, sclerosis of the navicular bone, or this often is where I gain a bit of an idea about how the balance has been changing or the angles, and because of a change of Farrier over time, you can get a great idea of how the horse used to be set up compared to how it is now, for better or for worse. Next imaging modality that I will lean on is going to be the ultrasound examination. And again, clinical might guide you there first if you've got some, effusion or swelling that's seemingly more acute. But I tend to start with radiographs and move to the ultrasound. I've listed here kind of my approach, collateral and palmar views of the pastern with my tendon probe, and then collateral ligaments of the coffin joint with the tendon probe. That can be a little trickier with if there's a little bit more hair coat and just really working the gel into the periocle to try and get a good window. Switch to a microconvex probe if I'm really hunting something down on the palmar, non-weight bearing views, and then transcranial I don't do very often. That's another one of these places where I'm a little bit spoiled, and if I'm looking transcranial, I'm most often going to just be referring for an MRI. But just the palmar view gives me a lot, and a lot of times it's just the negative findings again tell me a lot, that I'm not seeing any disruption in the DDF, that the obliques are okay, that the collateral ligaments are appearing normal. Granted, that's a bit of an iceberg kind of situation, so much buried within the hoof capsule. And then, so for most of the time from there, I can formulate a treatment plan. And then maybe it's the recheck exam when that treatment has failed that's going to drive me towards advanced imaging. I've kind of put a comment here about standing low field MRI versus a recumbent high field MRI. And I use both. I do try and guide, again, based on the case presentation. The standing is generally more accepted by clients, and so and more common and just a little bit more easily achieved. But if I'm suspicious of a cartilage lesion, then and I can get to a recumbent high field, then I'm going to push that direction, for example. But about 85% of the time, what you're looking for is going to show up on the standing MRI. So I'm pretty content with a standing MRI. And maybe if in a conversation with radiologists, you read it out that maybe I should be suspicious of a cartilage lesion because of some subchondral bone fluid, then if I'm really struggling at that 60 to 90 day point, and there's an option to go for a recheck, maybe this time I'll switch and add in the recumbent MRI as an option, or a CT if that's available in the area. that I'm at. The last comment I guess I'd make about the MRI is some of the pushback I'll get from clients, and I'm sure you've all seen this, is these lengthy reports, pages long with, you know, mild this, mild to moderate that, consider this. And so the MRI is only going to be in my hands as good as my clinical exam. And it really does sort of hone my thinking, but it doesn't necessarily give me the answer. We have wonderful radiologists helping us, and I do try and work with them and talk with them about my cases if I have further questions. But it might push me to go back and reblock the horse or go hunting with my ultrasound for something and change my therapy plans. A bit about therapy, trying not to burn up all the time on this and really kind of get to the meat of the corrective shoeing, but listed here some basic options. Some are physiotherapies, some are more injection therapies, some systemic. But for the caudal foot pain, the shoeing is just so critical. And when I was at Fairfield, Rick Mitchell did an AAP presentation, and he showed about 50% of the time we got these horses at least 1 degree sound, or if not sound, just with the shoeing alone. So it's a real critical aspect of the management. As far as therapy, some basic guidelines. If for me, in my practice, I avoid navicular bursa injections without an MRI. I just am real leery of injecting a DDF issue. I prefer biologics to steroids whenever possible. Again, lucky to have a population of clients that are steering that way also and have the economics to support that. If I do suspect, you know, I think one of the mistakes that happens is that we rush these horses right back to work. So if I'm suspicious of an injury, even if I don't go to an advanced imaging, it's just my rads and ultrasound, I'm worried that there's something going on soft tissue. I'm gonna really try and scale back the work, if not add some, you know, 2 to 4 week rest period while everything calms down. I think that's important. And then insist on the recheck. It's, you know, it's really hard to know. Sometimes you do these therapies based on sensitivities and mild lamenesses, and you inject the coffin joints, and then you might not see the horses again for 6 months, and then maybe they're lame again, or maybe they've been lame the whole time and you don't know. So that recheck becomes really valuable for me to know that I've got a problem, or maybe a chronic problem. Considerations for me as I'm coming up with a corrective shoeing plan, you know, the hoof balance obviously is a simple thing to look to correct. Big one for me, going back to that lack of sole depth, is dampening ground force reaction. And do I need to add a pad for this horse, change the setup to, you know, somehow soften the blow, a core, a pad, a combination therein. And, you know, and if a pad, what kind of pad? Not all of them are the same. And being specific when you talk with the farriers, I think, is important here. Breakover mechanics and using some of the pre-sculpted shoes to achieve some of the biomechanical advantages is great. We're lucky now with the pre-made. So if you don't have Stuart Muir around the corner from you, that you can, you know, resource with the Grand Circuit Denois shoes, or I like the Equilibrium line of shoes, some of these that are pre-fashioned to help you. And then there's this question of nail-on versus glue-on shoes, and that facet is expanding rapidly, and more common in my practice of using some glue-ons, not necessarily permanently, but while we're trying to achieve hoof growth and comfort. And you know, there's that sticky wicket where if the foot is painful, it doesn't really grow, and yet it's because it's not growing that the foot is painful, and that's where I often reach for the glue-on. And then there's just some horses I think don't tolerate nails in their feet, and getting away from nail-ons, maybe not forever, but for a period of time, can be very, very helpful. Collaborating with the farrier is going to be key to your success. And this is not a new subject. There's been papers over time that have talked about how to build a good veterinary farrier relationship. And here's just a couple citations. The way it works for me in my hands, at least I like to think it works, is feedback. You know, positive. Everybody loves to hear that things are going well, and you know, building that emotional deposit with farriers, and after you've looked at the horses, letting them know, I think we've made great progress, I love what it's looking like, really helps, especially when you want to call them and say, you know, I'm still worried about this, but is there something else we can do? I also can't rely on barn managers or owners to necessarily communicate my concerns or requests. And so just having a good line with the farrier, especially when we're dealing with farriers coming in and out, for example, when we're in the Wellington season, farriers aren't always there. So they don't necessarily know what's going on. And then they're going to show up at the barn, try and whap through a bunch of horses. And if I haven't been laying the groundwork with the farrier in the background, like, hey, when you see this horse next time, I'd like to switch to a blah, blah, blah. I think that's really helpful. And if I'm making a big change, I really, really try and just be there with the farrier and talk it out. Maybe we find a time that we both can get together just for 5-10 minutes, and then they come back and make the shoeing change, or I can be there with them and even x-ray the foot at the time. I think that builds a lot of the relationship and helps everybody be more successful and you know, honor their strengths in the equation, and it's not just about my time. And then I try and stay in my lane. You know, I cannot trim these feet. I can kind of know what I think would be advantageous, but I do not think I'm successful when I tell a farrier to put this particular shoe on or do this to fix this foot. It's more of a dialogue about, I think this horse has got some pain in his navicular region. He might have a bone bruise. I need to, you know, soften the ground force and give him better breakover. What do you think will work here? And, you know, they know things about how that horse grows, what it tolerates, what the footing does, how much turnout. Oh, it's a fly stomper. There's no chance. That's not going to hold up. You know, it's trying to set them up for success and choose the tool that in their hands is going to be the one that achieves the goal that I'm looking for. So that's kind of all I was going to say. Just put a couple, Steve O'Grady, his equinepodiatry.com website has a lot of great resources right now. And then just a nod to iCell, which is where I've really cultivated, I think, my best understanding of biomechanics and corrective shoeing. And obviously thanks to NEAEP and Virginia Equine Imaging for getting me here.
I think one of the limitations of this platform is that nobody can hear that you can't hear the applause, because so I will do it. That was really excellent, and maybe we can somehow incorporate that into Zoom in the future. But that was absolutely great. And I think we'll maybe do one question now that was directed at you. It came in early in the presentation. It's actually from Scott Lampert. And the question is, how much sole depth do you feel is adequate protection and support? Now, you can answer that, and then Stuart may also want to answer it at the conclusion. We can talk about all the questions together. But I thought that was a good one, and maybe you can address it.
I personally really like to achieve 2.0 centimeters, and I think horses are fine at 1.8, but I do also have, you know, this is where taking the x-rays kind of at the end of the shoeing is helpful, and see how much sole depth they've achieved, and knowing how carefully to trim them. And you know, there's some horses that they'll be happy with 3, and, you know, and vice versa, they're happy with 1.4, but I like to try and keep it around 2.
Great. Russillo, thank you so much. Really
Thank you, guys.
Okay. So the second half of the presentation is going to be done by Mr. Stuart Muir, who is a resident farrier at Rood and Riddle, Lexington, Kentucky. A native of New Zealand, in 2012, after he was already an established farrier, earned a scholarship to attend the International Hoof Care Summit, and followed up with that, but with a 10-day externship with Scott Morrison at Rood and Riddle. And something happened. He hasn't been kicked out yet, so here he is. Still at Rood and Riddle in Kentucky, and in 2014 earned his certificate, journeyman farrier certificate, and since then has been working on elite sport horses from Lexington to Wellington, Eastern Seaboard, and with also a board member of the NEAP, and integral part of getting this online platform for you guys. So again, take it from here, Stuart.
All right. Well, I'd just like to welcome everyone. I think it's a great opportunity for everyone in the equine community to get together and just hear the different sides of veterinarian and farrier thoughts and processes that they go through with caudal heel pain. Of course, when we think about caudal heel pain, it's a very generic term for quite a large area. And of course, in the front half of the foot, we call it caudal. We reference anatomical landmark by caudal, but the actual terminology for the front foot will be palmar and the back will be plantar. When I'm interpreting any kind of syndrome in the back half of the foot, there's numerous things for a farrier that really have to add up to have a really successful shoeing prescription. And that's kind of what I'm going to do with this slideshow is I want to run through all these things, and I'm going to insert some case studies as I go. So some of the things that I like to address is definitely limb conformation. I find limb conformation is really fundamental to what kind of hoof distortions I'm going to be expecting and how I'm expecting the horse to move dynamically through the shoeing process. Hoof conformation is, of course, completely related to that. The center of rotation or balance, also the center of pressure, the movements around the center of pressure with different shoeing prescriptions. I'm very interested in that and whether the shoeing prescription may kind of contradict itself over time, and I want to be super cautious of that. The environment is going to play a huge role in how these feet respond to different shoeing prescriptions. The discipline and how much traction they need, the sustainability of the shoeing. There's a lot of fluidity with horse shoeing where we're continually adapting. We may see a positive change and we need to go with that. We may see a negative change and we're like, hey, this shoeing isn't working and we need to change. And then, of course, pathology is really important as well. And once we've got all that together, we can start making some decisions about shoe selection and the mechanics that we want to see in those feet. So when I'm looking at limb conformation, there's certain things that can and can't be changed at different areas, different times in the horse's life. Of course, at a young age, the physis are open and we can manipulate those to get a straighter limb. And obviously we use the juvenile period of the horse's life for that. We want to understand where the force is directed with the limb deviations, whether we need to support that or be sympathetic to it. And can the forces be managed or redirected without creating further issues? I think where we assess the point of view that we assess these conformational changes are really important. The middle picture there is right at 12 o'clock, and you don't really appreciate the full deviations in the limb. It's not until we get out to 11 and 1 o'clock in front of the carpus and we actually see some of those real changes and the deviations in the limb. So just here's a recent case study of mine, and I've just put some dots on the limb there so we can appreciate that this horse has a little bit of inward rotation from the fetlock. Typically when we get that loading, it's going to put more strain down through the medial quadrant of that, and that's just with the trajectory of force as the horse's body weight is coming down the limb. In this case, the caudal heel pain was very, very simple. It was just a small bar crack. Nothing too crazy, but we still needed to manage it. This is actually at a show. You can see just that turn there, that the horse isn't very happy about it, and low level lameness, about a 1, but it's certainly something we can take control of, and we can manipulate the shoeing and hopefully get him sounder. So in this case, just put a hospital plate with a little hole there that I can access the bar. The margins of the bar looked a little bit necrotic to me, and I was cautious that it could eventuate into an abscess. So very, very simple, this case. And when I got the indication that that medial quadrant was overloaded for this horse with the conformational changes, I eventually put that horse into a stabilizer plate to redistribute force over a larger area of the foot. Hoof conformation is completely relative. There's a lot of things that I think farriers are taking on board although farriers are very hands-on people, we can interpret what we're seeing with our hands, and there's a lot of things that we're taking into consideration. Sole thickness has already been brought up. I think it's very, very important that the vibrations caused through locomotion are diffused by the time they hit the coffin bone, and we see that a lot in pedal osteitis and that kind of thing. The vertical positioning of the foot's really important to me. The solar contour, the frog position, the vertical frog position, frog health is really important. We see a lot of disease in a lot of these high-level show horses just from environmental conditions, and these are all things we need to incorporate into a shoeing prescription to make this shoeing really work for these horses. Here's just a horse that I was working on recently. It blew an abscess out that lateral quadrant. This is a hindfoot, so we're in plantar region. And it was kind of interesting, this necrotic area never really went away. It kind of hung around, and then this void opened up in the frog as well. So sometimes we, Dr. Russillo was talking about ground reaction forces. Sometimes we want to deflect those away, so the ground reaction force doesn't communicate with the foot at all. So in this case, I glued on a shoe and put a treatment plate in there to, so I could medicate these areas. And just 30 days later, you can see how this foot's cleaned up. And interestingly enough, I've reshod this horse here since then, and there's actually been a lot of hemorrhaging come through the foot, and I actually think there might have been some internal damage done, and it's just making its way out necrotically, and things are growing and progressing nicely with this horse. Sheared heels is another thing we see in the back half of the foot. I think we need to, a lot of these things that I'm going to bring up throughout this presentation, I think that we need to appreciate them from an internal anatomical sense, where we see the deviations from the outside, but it's really what's going on the inside that really counts. So here's just a specimen of a sheared heel kind of conformation. We could see that the medial quadrant there would be bumped up. But it's not till we get on the inside of the foot that we can appreciate some of the damage that's been done. There's been some good research by Dr. Belker about the organization of the digital cartilage and the fibrocartilage in the back of the horse's foot. Within the fibrocartilage, there's a very microvascular blood supply. So when we see these distortions from the outside, we have to appreciate in the heel region, and it could be that it may not be sheared heels, it may be another condition, but the organization of the structures is quite different and distorted on the inside as well. And I think that's a really important thing to consider when we're trying to rehabilitate these feet, that we're rehabilitating them from the inside out. It's very easy for farriers to become kind of focused on presenting a job that looks really cosmetically nice, but over time it's not sustainable. We're actually kind of, funguses and bacteria can set up on the horse's feet. If we get inside the foot too much, we can remove too much material and create more problems long term. So here's just the presentation that I was given on the first time that I shod this horse. Of course, we can see both medial quadrants of this foot are well elevated. What I'm looking at is this medial quadrant right here, the folding of the hoof wall back in towards the axial line of the foot. This horse conformation, so I think sheared heels are it's like an opportunistic condition where we've got conformation and a hoof capsule that's very malleable, where there's not a lot of integrity about it. So they can be very, very challenging to fix. This horse here, of course, carpal valgus, fetlock varus on the left front, carpal valgus on the right front, but certainly more conformation issues on the left front. These are the radiographs that I got to go with it. We can see that obviously this horse hasn't been shod for a while. This horse is also high-low, so there's a lot of things to manage here. And as the shoeing went along, it was quite challenging. Sole depth is quite thin, especially on the left front. And when I first was introduced to this horse, there was, of course, lameness was an issue. So we've got a little bit of white line disruption up the front of the wall as well on the right front. So there's a lot to do on this horse to even try and get it back on track. Radiographically, the DP shots, we're showing that imbalance. Also, I think there's a slight quadrant imbalance where this horse is tipped on a diagonal slightly to the inside. So a lot of work to do here. This is the first trim that I put on the horse. And when we've got hoof distortion like that, quite often really I'm just trying to pull the horse's feet back into some kind of parameters of normal, create some AP balance. At this point, hoof pattern axis, you're not going to get it. This is really like a salvage mission where we're just trying to pull all this back. Here's just a short video of how soft and supple these feet were to give you an idea why this horse had sheared heels so bad. We can see that displacement just with thumb pressure. So when I see that, how movable that foot is, really what I want to do is offer some structural rigidity. So incorporating the frog and with a heart bar, because the wall quality was so compromised, gluing on an indirect glue was a really good option. There wasn't a lot of sole depth, so I didn't want to adhere down onto the sole and create any kind of sole bruising through having the glue or the shoe directly attached to the sole. here's just 4 weeks later. We can see the amount of improvement we've made in 4 weeks. The foot is starting to return with some good, obviously the perfusion of the foot is good. We can see that the horse has responded with growing some foot, but the lateral quadrant's obviously very, very bruised, especially on the right front. We can see just all this kind of necrotic bruising coming through. I'll change my trim up again as well. I won't take all the exfoliating material out of the sole. I'll try and leave all that in and create some rigidity in the solar region because this foot's just moving so much. And it's kind of, there was another shoeing in the middle of this, but just because of the presentation length, 12 weeks later, of course, we can see we can make some significant difference on these horses, just with some basic corrective shoeing, acknowledging what the horse doesn't have and what the horse does have and kind of working with that the best we can. So the left front foot I didn't think did as good over the comparative 12-week cycle. I still saw that some medial shunting, but I really do think that that was because of the conformation on the left front. So conformation really does influence the hoof capsule conformation, the horse in flight. Sometimes farriers, we can get very concerned about how the horse is touching down and is it touching down evenly. Well, certain limb conformation deviations, we're not going to get a symmetrical or even touchdown upon landing. And I think that's just something we need to incorporate into our shoeing and perhaps offering some mediolateral breakover or help for these horses. The center of rotation in reference to caudal heel pain is really, really important. Quite often it's very, very easy for farriers to shoe kind of conservatively to keep shoes on, but when we're starting to see heel distortions, I think that's the first sign that the back half of the foot isn't doing so well. So sometimes what I like to do is almost picture frame the foot. Where would these distortions, where would the foot be if these heel distortions weren't there? And I'm going to shoot at that, because at that point, if we've got some kind of heel distortion, the foot's lying to me. All the, these structures are very malleable. There's a lot of fluidity about the foot. So I need to kind of offset that and offer some support to the back half of the foot. And of course, shoeing around the center of rotation aids in biomechanical efficiency. We can use hoof mapping, the widest point of the sole, to reference the coffin joint. And also it allows us to put the shoe on in an anterior posterior position that's going to be really beneficial to the horse. So this is again referencing the inside of the foot, what I'm looking for. The image on the right side of the screen is really important that we're offering that's the 50% often in the back half of the foot. And what I'm interested there is a lot of balance methods for farriers are done statically, but really the horse is very rarely in a static athletic kind of position. So we want to think about it dynamically. We know that there's a certain amount of forward momentum when the horse touches down. We know there's also a lot of de-acceleration when the horse touches down. So basically these forces are opposing each other, so the body weight of the horse can move across the top. When the body weight of the horse is moving over the top of the hoof capsule, we get this compression down that all aids in that de-acceleration. But it's also at this point where we get the maximum benefit from shoeing around the coffin joint. So when the horse's limb is under full load, we're offering the horse an even equilibrium anterior and posterior, and that alone can offset a lot of caudal foot lameness just by offering the support back there. So a really important part of any shoeing prescription and relevance to caudal heel pain. The center of pressure lies just back from the apex of the frog and slightly medial, and this is the center of force or center of pressure across the horse's foot. So on the right side of your screen is just a pressure mat, and we can appreciate with certain limb conformations that the center of pressure is somewhat transient within the horse's foot with different shoeings, and when we wedge the horse up, we do get some movement. So it's important that we consider that. And a lot of the time when we're dealing with the center of pressure in the equine foot, it's going to tell us how sustainable shoeings are. It can be the downfall of some shoeings, and it can really help some shoeings. And when we bring in the effects of the center of pressure into remedial shoeing, it's certainly one of those things that really need to be thought about, well thought out, and can we make this shoeing sustainable for a long period of time, given that this is going to be very passive working away at the horse during every shoeing cycle. So to do that, we need to identify areas that may be overloaded or compromised. So we're going to take a look at that. And we see this a lot with negative plantar or negative palmar angle horses. It's very, very common for when we see negative palmar angle that we just want to wedge them up and get that bone into a more positive position. But wedging them up, of course, the center of pressure at that point moves backwards caudally in the foot. So that could overload. Some of these negative palmar angles have very, very poor heel structure. So we need to be cautious of that. We certainly don't want to compromise the one thing that we're trying to improve. I think there's different sorts of negative palmar angle. The picture on the left side of the screen, of course, has a lot of sole depth that we could take some of that away and manipulate that bone back into a more positive position. The picture on the right, the bone, there's just no foot quality when the bone's sitting really, really low. So definitely different sorts. The one on the right there was very, very difficult to try and rehabilitate. We do see a lot of damage in the plantar aspect of the foot or the palmar, the negative palmar angle. The image on the right, of course, showing demineralization of the palmar processes. So, and I think that what's happening there are these horses have just touched down so many times and caused so much disruption in the back half of the foot that the bone is basically just kind of withering away. So these are all things radiographically I'm looking for. The picture on the right side of the screen with the circle around it, very, very hard to rehabilitate. You'll find there's no digital cushion. So if we were to wedge a horse like that up, it'd be very, very difficult, and you'd have to recruit other structures and go into a load sharing capacity to try and help that. We'll talk more about that soon. Here's a venogram of a fairly well perfused foot, and we can appreciate in the back half there, in the caudal region, that how much perfusion that we actually have. And quite often we don't get too concerned about when we see lower heeled horses and that kind of thing. But when we start thinking about shoeing these horses from the inside out, how can we help perfusion? Does this horse need support? What does it need? What's the hoof capsule telling me? What's the limb conformation telling me? Just to go on talking about the movement of the blood flow and wedging horses' foot up, we can see here that here's just another venogram of a horse. Of course, the first one there is just a very normal, well-perfused foot. And as soon as we put it into a wedge package, we can see the decrease in perfusion in the heel region. So quite often when I look at negative palmar angle horses, I'm very, very cautious about trying to fix it too soon just by wedging these horses up, or do I need to think about it over a longer time and actually rehabilitate these horses, try and get that fibrocartilage and the digital cushion organized, get the heel structure where it needs to be. So another option I'll use with these horses is actually a heart bar shoe, and I'll use the extra steel in the back of the shoe to try and give me a positive wedging in a deformable substrate. So just a few options. Just briefly about the environmental conditions and how they affect horses' feet. It really is, it's a wet dry, and we're trying to create some kind of homeostasis within the horse's feet. Certainly down in Wellington with those sport horses, the amount of humidity down there, very, very difficult. So quite often I'll use the seasons with the horse, and if they're going into a drier season, I'll try and retain more foot mass. So if they do go into a wetter environment, that I've got a little bit of foot behind me, and hopefully we can weather the storm, so to speak, and get the horses through with enough foot mass that we don't see a crazy amount of distortion while they're at high level showing. I think discipline is really an important part of any shoeing prescription, because we could put any kind of device onto a horse's foot, but if they don't have the amount of traction, or it's not safe, or in cases of raining where they're not sliding enough, and these can all create kind of more problems for the farrier to try and navigate as he gets through, because these are all things it's not like for every horse we can say, well, let's put a heart bar on it. For some horses it'll be too much of a decrease of traction, so we may need to recess and use stabilizer plates, or there's all these kind of variables that come into a shoeing prescription that are so important for farriers. And I think that's one of the wonderful things about the farrier craft, is that the amount of fluidity to the situation where we're adapting all the time, where maybe for a while the horse could be barefoot, and then we need it into a heart bar. And then we're like, well, the horse needs to work at high level, but we still need the stability. Let's go into a spider plate with some equipack. Maybe, so there's all these pieces of the puzzle that are so important for farriers. As far as traction goes, it's the amount of decrease or acceleration that we're interested in. Certain substrates are better for certain shoes. We've got to be cautious of that. And we've certainly seen evidence of that on synthetic tracks, where we can appreciate how quickly the limb is stopping in this video, that there's not very much disruption of the surface at all. And that's because the horse is coming and landing and everything, the foot is essentially sticking to the ground a lot more. So that's when we see a lot of catastrophic failure in the horse's feet. And that's when we see a lot of collateral ligament damage. We see on all those soft tissue structures in the back half of the foot when there's just not quite enough slide phase. It's very important that we moderate how much slide phase we have. Shoeing sustainability is really important. And what I'm acknowledging here is just the fluidity about the situation for farriers. It's very easy for a shoeing prescription to be handed down, but within 2-3 months time, that shoeing prescription is simply not going to work anymore, because any of these variables is shifted, and as farriers, we're very aware of adapting as we go. So as far as shoeing sustainability goes, it could come down to that we need to support more of the weaker structures. It may be that we need to incorporate other structures, and that would be a term with load sharing. Sometimes the lameness or the discipline may change. And we've got to remember that when we're dealing with caudal heel pain as well, that the lameness level must always be managed. If it's no point just putting a generic shoe on if it's not being effective against the lameness. So there's numerous ways that we can load shear. I think that there used to be an idea for farriers that the sole wasn't capable of taking any weight, but I think that's only a problem when we haven't got enough sole mass. I think retaining sole depth and sole mass is really important for these horses. So the picture on the left there, a fairly traditional heart bar shoe with a little bit of lateral support. Before I was talking about stabilizer plates and impression material. We can adjust the durometer or shore ratings of all these impression materials and paw and orthotics. And then we're also talking earlier about glue-on shoes and different shoeing prescriptions that incorporate more modern materials. So there's just a few jobs that I've done that I thought could really display load shearing well. Pathology, especially when we're talking about caudal heel pain, for farriers and veterinarians, and this is where I find personally working at the hospital, the integration of those two parties is so important. A lot of the time outside of practice, it can be simply that it's speculated information. We put hoof testers on, or like, oh, we've got a reaction across the frog, therefore it's got navicular, but then we'll find out soon that there's more than one type of navicular, of course. So, and then when we're dealing with pathology, of course, the veterinarian is going to be on the scene. We need radiographic, minimum probably some radiographs taken of this horse, realizing that the lameness is dynamic and it may get better, it may get worse, and we need to expect that and have some honest conversations with the clients and owners. We've also got to be mindful that hoof conformation and pathology doesn't always match or relate to each other. I've seen a lot of people talk about, well, it's got crushed heels and that'll be why it's lame. Well, a lot of horses are carrying more than one lameness at once. Certainly something to think about. So here's a case study. This is just an impar ligament strain. And what I want to point out here in the back half of the foot is just that the amount of digital cushion under this impar ligament on this side, and the deep digital flex tendon, of course, is coursing here against this side where we've got more digital cushion. So the morphology of the back half of the foot is really important when we start thinking about caudal heel pain and developing a good foot. We don't want to go in with a shoeing prescription that's just going to fix it instantaneously, and 6 weeks later we're back to where we begin. Sometimes we need to think about these as rehabilitating this whole back half of the foot and trying to get the digital cushion more engaged, better heel structure, more foot mass. So when we think about, here's just a computer generation, it's actually Jeff Thomason's, and just showing that the coffin joint would be sitting right in here, and just showing how much distal descent happens during locomotion for these horses. And I think that's where, for some horses, this impar ligament strain does become a problem. We've got all this body mass just forcing down onto the coffin joint and navicular bone. Here's a placentation. Of course, here's I'll just orientate you. Here's P2, here's the coffin bone over here, navicular bone. The deep digital flexor tendon will be coursing here. We've got an adhesion onto the navicular bone here, some sclerotic bone mass, and also here's your impar ligament sitting down here, and your suspensory ligament of the navicular bone sitting up here, and of course your bursa. So when people talk about navicular, I'm very much in the mindset of what type of navicular are we dealing with. If it's bony change and we've got enthesiophytes, or whether we've got sclerotic bone, it may be that we can just wedge these horses up and everything's going to be okay. Other horses, it's not that way at all. This horse here was one of those defining cases for me in my career, where the owner was not really interested in getting the vet involved too soon. And we tried 2 or 3 different shoeing prescriptions. This horse was a little bit reactive over the frog. Interestingly enough, it wasn't your classic navicular style foot. It was actually a wider foot. It wasn't in a contracted state. Discussions with the vet, though, where we, at one point, the veterinarian possibly even thought it might be saddle fit, but this horse was very on and off. One day it would be lame on the left, one day it would be lame on the right. So here's the lameness level that I was presented with. My apologies about the quality, but we can certainly see bilateral lameness on this horse. Because the horse was so it was lame and then it was sound, and we tried all these things, the owner actually decided that the quickest way would be to get MRI on this horse. And that was certainly my suggestion straight away. We went straight out of the gate into an MRI, just because the inconsistencies with this lameness. So there was, both had increased digital signal with the impar ligament. The suspensory ligament was also involved, and there was also some coffin joint effusion with this horse. And there's just the image of the MRI there. We can see the impar ligament sitting down here, and this is just a little effusion around the coffin joint and also the suspensory ligament. I put a elevated, graduated heel, I wedged it up. I put a SM aluminum heel plate in the shoe. The reason for that is I want to create a greater ground force reaction when it lands. And also the navicular bone is going to be sitting right in about here. So I'm creating protection for that area as well. But the interesting thing was the the MRI recommendations from the veterinarian were to put this horse on 16-week stall rest. And it made me realize that without that information from a veterinarian, I may have been doing this horse somewhat of a misservice by trying different shoeing. So it was a case for me that really did exemplify why vets and farriers need to be in communication with each other. And here's just an after video. This is 16 weeks later. I mean, you'd hardly recognize it as the same horse, but good information, good shoeing, good prognosis for the horse. Here's another case that I dealt with. This is a tendonitis, the deep digital flexor tendon, more towards the right front. Interestingly enough, farriers pick up a lot of information when we're shoeing this horse. This horse was always really heavy to shoe, and it was one of those horses that, to be honest, I nearly dreaded shoeing sometimes. Again, we tried 2 or 3 different shoeing modalities. The owner was very, very open to just trying some stuff. The horse was a little string holding behind, and she was a little resistant about laying it down for an MRI. The picture on the right side of the screen is the shoeing package I always had it in. I put it in a little bit of lateral support. Conformationally, this horse is a little bit fetlock varus. The horse did have a little thrush, and that's why the leather is taken out across the frog there, so we could medically treat that. Then the owner suggested that she thought it was the thrush causing the lameness. So we shod the horse. I put a rocker heel into the horse to try and take some pressure off that area and put a treatment plate across the bottom. And then we went to a more elaborate breakover style shoe with some soft heel polyurethane. This is the Whirly shoe, a very, very good shoe. But all these shoeings were fairly ineffective against this lameness. So without boring you and reading all this information to you, basically the horse had on the right front tendonitis of the navicular bone, and we can actually see some of the striations within the lateral lobe of the deep digital flexor tendon. And this is why, of course, the shoeing was ineffective against the lameness, because the established pathology was so great. But I think this is a really good case, and Dr. Russillo as well was saying, some of these cases, you've got to think outside the box. And it's certainly one of the things that working at the hospital has taught me, that we can't be too polarized or general about some of the lamenesses we're seeing with these horses. So I think it's important that with the use of diagnostics that we appreciate the scope of some of the pathologies that we might see, and how they can be really tricky to navigate around. Just some more MRI images showing those striations within the deep digital flex tendon. So this horse continued to do worse and worse and worse against all our efforts. And so this horse went down for another MRI, and here's just a video of the second MRI that it went through. And we can see basically just a big lesion in the deep digital flex tendon. So this horse's lameness just got worse and worse, and we're on a downward trajectory. So I guess the take-home message with this case is that pathology is progressive. It can get better, and it can also get worse. And there's one of those cases that got gradually worse. And I think as practitioners, we need to be mindful of that we can appreciate that we may need more assistance from either party. So to kind of summarize this presentation up, I think for farriers that when we're dealing with caudal heel pain, it's important that we all understand that this is multifactorial things that come into the equation. Assuring prescription certainly can't just be handed down, and because it could contradict itself quite easily in a very short amount of time. But I do think that if we take limb conformation and hoof conformation and the pathology, the discipline, the center of pressure, and the mechanics and the environment, we can start to think about making a good selection for the shoeing. And then we can also think about modifying those shoes. But when we're dealing with certain levels of lameness as well, I think it's really important that all the practitioners that we do work within our scope of practice. Certainly myself as a farrier, I've found that I've evolved. I can't, 10 years ago, I'm not the same farrier now, because we keep learning more and more. So, if you haven't had a lot of experience with a lot of lameness, try and spend some time with someone that has. There's just an infinite amount of possibilities with equine lameness, and I think we need to be mindful of that. With that, I'd like to thank the NEAP and everyone that's attended this webinar. It's great to see so much interest in everyone online for it, and thank you very much.
Could hear that. I tried to procure some applause through an app, but maybe nobody heard it. Anyway, Stuart, thank you so much. That was great. And as expected, there are a bunch of questions. I know that we're at 8 o'clock. I would invite people who need to go, but I want to interject quickly to say that at the end, after a few questions, there's going to be a poll that we'd really like all the attendees to fill out. This is going to help us know what we did right and what we did wrong tonight, because we're going to keep rolling these things out, and they're going to be great, and we need your guys' feedback. So if you stay, please answer the poll, and hopefully if you head out sooner than that, we'll be able to email it to you. And please send us any feedback that you have. Again, thank you, both Dr. Russillo and Stuart. I think some of the questions that are, that have been sent in will be easily answered, but maybe best answered by both of you guys. So I'm gonna read a few of them, and maybe you guys can both answer these together. So one of the first questions that came in was from Edward Samuel, who asks, will a heart bar shoe help to alleviate the pain at the heel? Stuart, I know you had talked about it a little bit, but maybe Cricket could weigh in a little bit about heart bars in general.
Cricket?
And you're muted, Dr. Russillo.
I'll start off then. I think we've got to be careful with the use of heart bar shoes. I believe that the amount of pressure we put on the frog is really important. I like to think about my heart bars being negative pressure, which is no contact with the frog, neutral pressure where the frog is just touching, and positive pressure where I'm actually depressing onto the frog. Honestly, I can't tell you the last time I put on a positive pressure heart bar. So can it help the back half of the foot? Yes, but we've got to take into consideration the limb conformation and the hoof conformation and the lameness. I don't think we can just generically prescribe a heart bar.
And I agree with obviously everything Stuart's saying. And I think this brings up your point earlier, Stuart, about the load sharing. So, yes, we want to share the load to relieve some of this heel, but we have to be careful about how we distribute that load. And so, and then of course, with the workload of the horses, heart bar is a great shoe for horses, hand grazing and stall rest if we're, dealing with a bigger issue. But when you're in an athletic circumstance, maybe that's where that spider plate is, for me, a bit more of a approachable facsimile.
I think it's important that when we put any therapeutic device on a horse, that we're incorporating, if we're going to load up a frog and it's got a diseased frog, well, there's a contradiction in your shoeing straight away, enough to make a horse go lame. Then the application of a heart bar gets a bad name, but it's actually the application of the shoe. So we've got to be careful.
Great, thanks guys. Our next question came from Joshua Sanders, who asks, do you find that negative palmar horses do well in a full rocker shoe or banana shoes, since the wedging in this way doesn't move the center of pressure in a palmar direction? Good question.
Definitely an option. In sport horses, I don't know about you, Dr. Russillo, but I find them really difficult how much mechanics to put into a shoe, because we still want biomechanical efficiency as well. But definitely a good option. And we see horses perfuse really well with a roller motion style shoe.
We have a question from an anonymous. This is a question regarding center of rotation and pressure. Do you take into consideration when the horse has hoof pain or pain in general that they don't land, load, or use their hoof limb the same as if they didn't? Do you feel this changes the center of rotation point or center pressure?
Sorry, I'm going to need that one more time.
So the question is, I believe that I'm interpreting the question as, that a horse that's not that's not landing appropriately is going to change the center of rotation, and how would you address that with with your treatment plans?
Well, the center of rotation is not going to change. That the heel touchdown might change depending on how much support or shoe length we put on these horses. We can create a more even equilibrium there. Without wedging the horse, the center of pressure is going to remain unchanged.
This next question also from anonymous, and I think we can probably do one or two more. How does footing play a role into your shoeing choice, and in what manner? I think that's a great question.
Maybe I'll jump in on this one and just say that I think footing in my disciplines, I'm in the sport horses, you know, it's all mostly these days it's synthetic. And the big issue I think is what Stuart was talking about with the slide, and, you know, being careful not to make the shoe by definition a bit too grippy when it's already a grippy footing. The other thing that I look at with footing and is if there's a pad, like a leather pad on a foot might get too slippery on a grass surface. So I don't think it's a really complicated thought process, but I do think you need to keep it in mind when you're developing what shoe is going to be sustainable. Back to that sustainable piece as these horses are moving around and going. Another example of footing might be for a jumper crowd that's rotating on their summer circuit. They might anticipate that this horse gets footsore in this particular footing at the show when they're there for weeks on end, because it's maybe more of an old-fashioned or older footing and doesn't have as much rebound as it needs. And so we commonly might think, well, let's put a pad on that horse before it goes into that constructive footing.
Great, guys. All right, maybe we'll do one more here, unless you guys need to run. This is a question from Scott Meyer, who asks Dr. Russillo, do you find negative plantar angles contribute to significant lumbar and SI pain?
I do look for negative plantar angles, and I think it adds load and strain to the SI. Yes, I would be careful about significant, but I do think it potentiates inflammation of that area, along with you know, other aspects of the horse's job that augment that area. And negative plantar angles for me, something I think we're just gaining an appreciation of, and it's been talked about more recently. And I do a lot more balance radiographs of hind feet than I ever did before, trying to look at that and talk with the farrier about how to address it. And my most common go-to there is a frog support pad, and it tends to help support the foot, take some of the pressure off the heels, kind of help the horse grow out a bit better, digital cushion. And it's a crutch, it's not a permanent solution. And more often than not, it's pretty well tolerated. Stuart, what's your go-to there?
Yeah, I tend to agree with you. For negative palmar plantar horses, I've seen better results over a longer period of time than manipulating them over a shorter period of time. So for me, it's rehabilitate the foot. We've got to understand that the structures that lay proximal to the foot, if we haven't got a foot that's functioning well and doing its job properly, we could slap any shoe on any foot and it might do okay. But the foot is very, very well designed. It can take this load, but when the foot's compromised, the structures within the foot are compromised. So sometimes some of it is just starting literally from the ground up. Rehabilitate the foot, rehabilitate the structures, and I tend to use when horses are in rehab, I use that time really aggressively to try and rehabilitate those feet and make sure we've got a better structure to start back on.
Great, guys. All right, questions keep coming in, so I'm gonna let people. This is great that there's such good engagement. So I'm gonna keep answering questions. If our panelists need to go, they can just run. Okay. Talia Gonzalez, hopefully I'm pronouncing this correctly, asks, do you have a clinical difference between a normal and soft impression material?
Yeah, the durometer rating or shore rating of your impression materials and poron orthotics change company by company. A lot of them are more stable through different temperatures and climates. So those are all things you want to do research on when using them. But I'm also very cautious about what kind of products I'm putting against different structures. Earlier on, we talked about sole depth and that kind of thing. If you've got really thin soles, I wouldn't go jamming anything too hard against it. So I always try to mimic whatever the horses have already got. So if I've got thin, pliable sole, I'm going to put in a softer durometer rating product.
Thank you. We have a question about the heart bar pad. Kate Pouch asks, what are your thoughts on the heart bar pad?
Dr. Russillo?
Well, so I don't tend to recommend that solution, but I have seen farriers come up with that solution, especially with the negative plantar angle horses, that's kind of their in-between stage to help repair that digital cushion and get some better growth. This kind of highlights my previous point of I have a conversation and say, I don't like this about this foot, it's causing this problem. What are some strategies that we can employ? And that might be the strategy that they go for, but it's not something that I lean on as a crutch to hand out or prescribe, so to say. I
think sometimes as well, when we do bring a foot into load sharing, I think elevating the horse's foot up on the branches of steel will really challenge the central middle aspect of the foot. So even just bringing something else in, you're kind of creating this effect. Pads come with complications though. The fungus and bacteria activity underneath them, we need to medicate heavily with copper sulfates or other things like that. So it's just not as straightforward as what it always seems.
Great. We have an anonymous question about MRIs. This is in regards to a horse that blocks to a PD. If an owner is willing to spend the money for an MRI alone without other imaging, is that okay or excessive?
So if I understand the question correctly, a horse is lame, blocks to some distal or proximal digital nerve block, and owners kind of thinking, oh, we need an MRI. And, as veterinarians, you turn them away to that idea. I think an MRI is going to give you good information. The challenge, as I was trying to talk about a bit in my talk, is it's going to give you a lot of information. And so it's probably better than just using an ultrasound machine that you're not comfortable with. It's probably not going to give you some information to monitor over time because you're not going to go right back into the magnet. So it may push you to ask for further follow-up, maybe radiographs of said structure that's more interesting relative to the findings. But, I'm never going to, I think the challenge is living without the MRI, not saying no to the MRI.
Right. Another question, probably directed at Stuart. How do you choose the type of pads between Deplano or plastic pads?
It's really a case by case. I think the environment has a huge part to do with that. I personally find that in a humid environment, I get a lot more fungal bacterial activity underneath plastic pads. So I think the leather can breathe a little bit more, and that could be beneficial.
Great. This is another anonymous question. Can you talk about trimming protocols for shoe selection? Maybe a big question, but maybe you guys can touch on it.
Do you want me to go first?
I'm not really sure I understand what the question's asking.
An anonymous attendee, so I can only ask for them to perhaps ask the question a little bit a different way. I think also what we could do is, we're in this forum, we can say to anonymous, you can send us an email, and perhaps if we can do a little bit better job answering the question, if it's phrased a little bit differently, then we will do that. One last question from Edward Samuel, who asks, does a wire mesh at the sole with silicone filling around the heel help to cushion the caudal part of the foot by taking off the pressure and decreasing pain?
Sorry, one more time.
Does a wire mesh at the sole with silicone filling around the heel help to cushion the caudal part of the foot by taking off the pressure and decreasing pain?
I think it's possible. Whether you're going to get a significant amount of ground reaction force out of that, I'm not sure. The other thing about a welded in bar of some description is you're offering a lot of structural rigidity to that foot. We're taking out the independent heel movement. So some horses like to have heel movement, but it's all within a physiological range where too much is bad, too little is too bad. We've got to try and find that neutral spot for these horses right in the middle. So any thoughts?
I would have said that's kind of one of these in-between moves. I don't know that it hurts or helps necessarily, but yeah.
I think at the end of the day, we're looking to neutralize these vibrations that are caused through locomotion a lot of the time. It's not that we want to lock the foot down and not have it perform well. If we don't get those vibrations to the correct anatomical landmarks, well, they won't be diffused in a correct manner, as if we can allow that foot to work as normally as possible, or aid it, if we can help it. But I think it's all within a physiological range for me, where some need opened up, some need shut down.
Guys, I think there are a few more questions coming in, but I think that we will try at least this time to keep it, we're well over an hour now. If the feedback is we want to do an extra hour of questions afterwards, then that's what we'll do. For now, every question that hasn't been answered, I know where to find both of these people, so I will get your questions answered and email you back. I want to thank everybody for attending this first webinar. We're planning on doing a bunch more. We know people are at home. We know that we have tons of valuable information to share, and we hope this one, our inaugural rollout, was great, and I think it was. So I think that we can do a Zoom round of applause for Dr. Russillo and Stuart. Thank you.
Thank you.
Thank you all.